Question number 2. What's most important? Transparent data on cost, quality, or service? Definitely Eva.
Service.
Service. And the survey says they're all the exact same. Equal number of
Cheating.
responses.
That's
Trick
good.
question. Which actually is a little bit interesting, isn't it? The public sees all three of these, transparency around all three of these areas is the same level of importance. So what do you think about that? Are they, in fact, the same level of importance?
Well, they're all connected to each other, and so I think perhaps it's hard to separate which one is the most important.
Okay.
The quality and the service are important, and I think when we do things that the patient can expect the outcomes to be a certain way, we also protect and standardize what the cost will be in a way that makes it more predictable so that they understand what it's going to be.
That's a good comment. Ladies, what do you think?
I think that they said cost, quality, and service are all important. It is consumer-driven care. They are all important. From a perspective of safe, low-cost care, we provide the service in the safest, lowest cost environment. They're going to get all three of those. We have to change our environments so that it's a true statement.
Yeah. Okay. Bonnie.
Yeah. From a consumer, I think the quality and service is what I see up front, and then when I see the bill, that's the cost. So they equate, the quality and service should equate out to the cost. And so they expect you to have the highest quality. They expect you to be nice to them, to really provide that service. Now we got to look at the cost. So that's why they all three go together.
So studies show that consumers equate their experience, how they were treated, how nicely they were treated, what was the bedside manner of the clinicians, they equate those things with quality.
Yes.
When it is in a sense, but in another sense, it's really not at all related to quality. What do you think about that? Is that a proper way of looking at it? And if not, how do we adjust it?
I think a patient comes to the hospital expecting they're going to get the quality of care. I came to the hospital for you to take care of me, and I expect you to do exactly what's right. But what they see and what they experience is that service. So you could heal them and make them healthier than when they came in, but if they had one bad interaction with a clinician, that's all they remember. And so they expect the quality, they expect the service, but that is what they perceive more as the service. So I think that's really what drives your quality.
Okay. Yeah. Other thoughts on that?
No, I think it depends on the lens you're looking through. I mean, if you're the patient and you're trying to have a good experience, it is about making sure that the care that you received was appropriate, that it got you back to wherever you were before you had to come into the system. But that can be done in a way where the service is complementary, right? As you mentioned, quality is expected, but the service is maybe the little extra things that are done to improve their experience so they can walk away feeling good about what happened to them, as well as that the outcomes were good.
Yeah. So it's easy for those of us in healthcare who understand clinical outcomes perhaps a little bit better than the average member of the public to determine what is quality and what isn't. So how do you break down transparency around quality so it's understandable, so it's digestible to the average person?
I think that's really hard because for a patient, when you look at the quality outcomes, they want to make sure that when I come into the hospital, you don't hurt me and that I go home better than I was when I came in. To them, that's quality. To quality as a clinician was that the outcome is good, but CMS will look at it as you gave the aspirin upon arrival, or you made sure that you had antibiotics before your cut time, before surgery. That's quality kind of in a clinician's eyes because that's what we're measured against. To say that to a patient, they're not going to get that. That's just something they don't understand. So truly the service or the experience that they have, they expect to get their pain medication on time. They expect for you to make sure that I don't get the wrong medication. For them, it's not harming them, it's the quality that they perceive.
And when a patient's in a bed, they're in a foreign environment to them. When an alarm goes off in the room, they perceive quality as someone is answering that alarm immediately, quickly. So if we're slow to get to changing the pump where it's not alarming, they think that they're not getting the best care possible. So you've got to look at it from the perception of the person sitting in the bed and what they're thinking. What's keeping them up? We focus a lot on their clinical problems. We need to start focusing on what's worrying them. So starting the conversation is, what is concerning you? Is there anything worrying you? We'll change the dynamic and change our message to, we do care about the fact that you're here, as opposed to what we worry about that they don't know we're even worried about.
Thanks for those responses, contestants, and Eva takes the round.